like the word old. I'm far better traveled than she is.
I like it.
I'm,
I like it.
I'm on my 78th trip around the sun.
Yeah.
So I've traveled umpteen billion years or 18 umpteen billion miles by now.
Yeah.
So I'm proud. Um, and yet I wish I could show you some pictures on this. I'd show you a picture of me at 50. At 50, I was round. My face was round, my body was round. I could have not run around the block if my life depended on it. I'm 78 years old. But for the last 31 years, I have had the global hormone balance of a 25-year-old man. That didn't make me 25. I have white hair. I have some wrinkles. And yet now, what is nearly 30 years after I was soft, fat, and round, I can sprint at 7.9 miles an hour. I can run 3 miles before I'm short of breath. I can bench press well over 200 pounds. I'm married to a woman 30 years my junior. I have a 13-year-old daughter at home who was born when I was 65. My life is full of joy and energy as I'm approaching 80. And I believe that I should not be alone in this. Every elderly man in this country should be running down the street every morning for miles with a big grin on their face, smiling and happy and having a full, joyous life instead of shuffling off towards the nursing home. So for me, that's what longevity medicine is all about.
All right. Dr. Jerry Mixon, thank you so much for being on the show today. We were, just kind of in our intro, and I apologize. Like I told you, I've had just about every technical bug you can face I've had this morning. And so usually I'd like to visit with you a little bit before we record, but I want to be respectful of your time. And you were just talking about was something that I think makes a lot of sense in that this whole movement towards longevity, which you and I are going to talk a lot about today, it comes out of what used to be kind of woo woo. People didn't, when you hear holistic medicine, functional medicine, then all of a sudden the anti-aging thing, the marketers take hold of that. Then comes longevity. And now that to some degree is getting bastardized by, people again, marketing geniuses. They've figured out how to make a buck off the word longevity. And then it's always fun for me as someone who operates in this space, who's always looking at health span and at looking at longevity from the cellular perspective and trying to actually use preventive care and health and wellness, not as just a vanity play, but it's just to live life better. It's always encouraging to meet someone like yourself. So let's continue with the conversation we were having before I hit record and in how you started to focus on longevity and and again, as a definition of terms, tell this audience from your perspective what longevity medicine actually means and how you practice.
All right. Well, let's start with a couple of basic definitions. Um, I am frequently asked by patients, why don't you accept my insurance? And I have to tell them, it's not that I don't accept your insurance. It's that your insurance doesn't accept the fact that this is a real disease. Getting older is a natural process, but so was bubonic plague. It killed about 1/3 of the human population every 20 or 30 years. The plague swept through Europe. It's perfectly natural. Those bacteria carried on the fleas are living just like we are, same right to share our ecospace. The fact is that aging kills 100% of its victims. And anything that kills 100% of its victims should get the attention of a physician. Just strikes me as reasonable. Just because something is normal means it's what usually happens. But just because it usually happens doesn't make it good. If most of the families in America got divorced or beat their children, would that make it good? Just because something happens a lot doesn't make it beneficial. And so there's a lot of stuff that is perfectly normal part of the aging process that is destructive. Every year, we peak in our physical strength, in our speed and flexibility, we peak in our teens. 14-year-old gymnasts beat the socks off 40-year-old gymnasts. Um, we get our peak at muscle strength, raw power at about 25. And by 30, we've lost 1.5 to 2% of that power. We're already heading downhill. Um, our cognitive skills are fastest in our late teen years, 17, 18-year-olds. Then can multitask, handle 15 different things, rapid fire. As you age, you have to focus on one thing at a time. You do one thing, you do it well, you move to the next thing. Okay. Speed of processing slows with age, but complexity of processing improves until we're about 50. And so you've hit your peak executive skills late 40s to mid 50s. But physically, you're way down the curve by the time you get there. Okay. So what is aging? Well, we don't all age at one time, even our brains. Different aspects of our brains age at different rates and mature at different rates and hit their peaks at different points. And same thing with our physicality. And you and I, good Lord made us based on a general plan: 2 eyes, 1 nose, 1 mouth, usually 32 teeth, but sometimes 34 or 30, depending on whether or not you get your wisdom teeth and at what point. 1 heart, 2 lungs, etc. But within that general plan, there's enormous variation. And your heart may not age at the same rate as your lungs, or your kidneys, or your brain, or your skin, or your bones. So we are a complex organism. Each aspect of us is aging at a slightly different rate. By aging, here we mean going downhill, losing its peak capacity. And that's basically my definition of aging, is the progressive loss of capacity. I hear people say you should learn to age gracefully, but aging is the progressive loss of our graces. You get clumsier, your balance starts to go. You can't dance on one toe like you did when you were a kid. So my 13-year-old daughter and I are both épée fencers. Her 13-year-old self on the fencing strip is a far cry from my 78-year-old self on the fencing strip. Right.
Of course.
We're using the same weapon. We both have them. We both have our uniform. But I'm male, and I don't like the word old. I've far better traveled than she.
I like it. I like it.
I'm on my 78th trip around the sun.
Yeah.
So I've traveled umpteen billion umpteen billion miles by now.
Yeah.
So I'm proud. And yet, I wish I could show you some pictures on this. I'd show you a picture of me at 50. At 50, I was round. My face was round, my body was round. I could not have run around the block if my life depended on it. I'm 78 years old. But for the last 31 years, I have had the global hormone balance of a 25-year-old man. I like the word old. On my 78th trip around the sun, I've traveled umpteen billion miles by now.
Yeah.
So I'm proud. And yet, I wish I could show you some pictures on this. I'd show you a picture of me at 50. At 50, I was round. My face was round, my body was round. I could not have run around the block if my life depended on it. I'm 78 years old. But for the last 31 years, I have had the global hormone balance of a 25-year-old man.
Wow.
That didn't make me 25. I have white hair. I have some wrinkles. And yet now, what is nearly 30 years after I was soft, fat, and round, I can sprint at 7.9 miles an hour. I can run 3 miles before I'm short of breath. I can bench press well over 200 pounds. I'm married to a woman 30 years my junior. I have a 13-year-old daughter at home who was born when I was 65. My life is full of joy and energy as I'm approaching 80. And I believe that I should not be alone in this. Every elderly man in this country should be running down the street every morning for miles with a big grin on their face, smiling and happy and having a full, joyous life instead of shuffling off towards the nursing home. So for me, that's what longevity medicine is all about. That
Well,
didn't make me 25. I have white hair. I have some wrinkles. And yet now, what is nearly 30 years after I was soft, fat, and round, I can sprint at 7.9 miles an hour. I can run 3 miles before I'm short of breath. I can bench press well over 200 pounds. I'm married to a woman 30 years my junior. I have a 13-year-old daughter at home who was born when I was 65. My life is full of joy and energy as I'm approaching 80. And I believe that I should not be alone in this. Every elderly man in this country should be running down the street every morning for miles with a big grin on their face, smiling and happy and having a full, joyous life instead of shuffling off towards the nursing home. So for me, that's what longevity medicine is all about. I
I
want us faster, leaner, smarter, sexier, and happier than we used to be.
I love it. And I love and you said something there than you used to be. That's one of the things I think a lot of people lose sight of, and I love to talk about on this program is that no matter what stage of life you are, doesn't mean you can't improve upon where you've been, even in your younger years. I mean, I've trained. I was an NCAA athlete. I played football in college, and so it was kind of like part of my DNA forever. However, there was a time whenever I backed off and didn't focus and I wasn't as educated on how to really I didn't focus on VO2 max. I didn't focus on mitochondrial health. I didn't understand caloric restriction and the benefits that it would have, and I didn't understand anything about hormone balance and kind of the things you can do to operate in that space. And I can honestly say, Doc, that I'm 51, and I know I'm in better shape than I was when I was probably 31. I can recover just as fast. I can run. I probably can't run as fast, but I can jump nearly as high and do those things. And I think that, and also you said another thing I want you to kind of touch on. I have a dear friend of mine, Harley Hooper. Harley, if you happen to listen to this, shout out to you. He is much like you. He stays active. He owns the finest men's store in America. He's a dying breed. He is like a modern day Stanley Marcus. Goes to work every day, still up and down measuring men. I mean, a world class entrepreneur. He's 78. He's your age. You would never know it. He does the things that he was doing when he was 50, 35. And a lot of it is his mentality. He refuses to accept that my chronological age should determine my behavior, my actions, and the things that and my goals. And
Yeah.
so to hear you say those things, it's encouraging for me because that's what I'm shooting for. And then kind of just to tie a bow on this, your philosophy is one that I think more people should adopt, which is this isn't just about a linear if X, then Y. It's more of a mindset of living life well. It's not just about hitting physical metrics. I can do this. And because I'm this age, I can no longer do these things. But it's continuing on with the things you could do before and still you can improve upon at any age. So I think that is terrific. Now, one of the things I want to talk about with you to try to bring some actual practical application to that. I think you have like 12 metrics or 12 measurements with regard to stem cells, hormones, mitochondrial health, all these different things that, and we can take on all 12 if you want, but I would like to like from your standpoint, and we can break this down the way you think makes sense, whether it's age group, stage of your health, but where do we start to focus? Do we start with overnutrition? Do we start with mobility? Do we start with cardiovascular? Like someone that hears us talking about this and says, I want to be like Dr. Mixon, 78, have a 13-year-old daughter that I'm fencing with, not just be able to have a 13-year-old daughter, not just Picasso, but I'm actually out there fencing with all these things. Where do you kind of start that journey to to start these building blocks?
All right. If I had a magic wand to make improvements in America's health, I would start by making us lean.
Mm.
Okay. Fat kills. Fat causes cancer, dementia, heart disease, osteoporosis, kidney failure, blindness, diabetes, all of this. You can think of your body as two major components. One is fat and the other is muscle. Fat is destructive. It's not cosmetic. It's not something that is inert and you simply carry it around and it makes lumps and bulges. Okay. Fat is an active gland. It's producing over 80 different compounds that it's dumping into your bloodstream that promote atherosclerosis, narrowing of your arteries. It increases inflammation everywhere. And that inflammagene is the phrase we use, of this chronic low-grade inflammatory process in our brains is causing your neurons to get sick and die faster. So our brains tend to shrink with age in large measure because we have chronic inflammatory changes due to our body fat. The inflammation triggers cancers. It triggers heart attacks. It triggers plaques in your arteries. It helps to thin out your bones. Okay. It causes your joints to start degenerating. Americans live a long time, but we live a long time with chronic diseases, far longer with more chronic diseases than almost anyone else on earth because we get sick younger. We have a very expensive, very complex medical care system that keeps us kind of going, but we stay sick. So one of the most destructive things is excess body fat. If you can't see your abdominal muscles, you're too fat. You can make all the fancy charts you want, but if you stand in front of a mirror and you do not see those rectus muscles, you're too fat. It's that simple.
Yeah.
Okay? You have excess body fat, you need to get rid of some of it. The second thing is muscle is also an active gland. Working muscle produces over 600 different proteins that it dumps into your bloodstream, including brain-derived neurotropic factors that actually helps you to grow new brain, to grow your peripheral nerves, to keep your balance, your coordination, your cognition. Those 600 healing, anti-cancer, pro-growth, pro-repair proteins are produced every time a muscle flexes. So the more muscle you've got, and the more frequently and intensely it is flexing and being used, the more healing promotion you're going to be putting into your system, and more anti-inflammatory, in fact. So on the one hand, you've got fat trying to increase inflammation. On the other, you've got muscle trying to suppress inflammation and promote healing. Destruction, repair. Destruction, repair. The problem is, because we are losing our glandular function starting in our late 20s to early 30s, women's ovaries start going downhill. Men's testicles start going downhill. Your adrenals are going down. Your thyroid is slowing down. Your hypothalamus is decreasing. Every gland in your body is decreasing its level of function, and it's putting out less and less of those hormones that we had in our adolescence that basically dominated who and what we were. And so 30 years ago, when I started the clinics, that was our focus. We said, wait a minute. I'm not just talking about testosterone or estrogen or progesterone. If we look at the global endocrine support that we're losing with aging, and if we move it back to where it should be at our peak, I bet we'll get better. And it turned out to be true. We measured 8 different hormones, growth factors, inflammatory markers. And if we moved everything we could back as close as we could to a mid-range 25-year-old, people got better. Pain decreased, muscle mass increased, bones got denser, fat shifted our metabolism away from fat production towards muscle. And so that was the first stage of my longevity clinics, was measuring all of your hormones, all of your growth factors, all of your inflammatory markers, and working to put things back to where they were at our physical and mental peak, which is in the mid-20s. I don't want you to have the testosterone load of a 16 or 17-year-old boy. I want you to think of something besides sex once in a while.
Right, right.
Uh, but I also want women to have an adequate anabolic testosterone load. Um, One of the big mistakes that many people, including most physicians, make is they think that estrogen is the primary female hormone, and it isn't. The mistake comes because we measure estrogen in picograms per milliliter, and we measure testosterone in nanograms per deciliter. But if you put them in the same units, so you're measuring them on the same scale, it turns out that a 20-year-old woman has 2.5 times more testosterone than estrogen in her bloodstream.
Wow.
Testosterone is the major human sex hormone, male and female. Now, she'll run a testosterone of about 70 to 75 nanograms per deciliter. Her estrogen is going to peak about 30 nanograms per deciliter.
Wow.
And the difference is yours and mine. When we were 18 or 20, we peaked at 1,200 to 1,500 nanograms per deciliter.
Wow.
People talk about women being hormonal. No, we're the hormonal ones. It's not them, it's us. We're carrying a total hormone load. It is a major factor, 10 times what the average woman has in her bloodstream. The difference is they cycle once a month and we see menstruation. And so, we say, oh, that's her hormone shift. You and I, we cycled twice a day. When you were a young man, you and your wife, you woke up in the morning, what was the first thing you thought of? Sex. I want. You peaked sun up and you got this sudden urge and you couldn't, and then during the day, your testosterone level moderated so you could work with other men and not kill each other. And in the evening, she's trying to get the dishes done and you're standing at the sink groping her because sundown, you've got your evening surge.
Right.
We cycle twice a day, so we don't notice it hardly. It's just part of our day.
Right.
So people misunderstand the hormones to start with. So 30 years ago, we started moving everybody's hormones back to a healthy 25-year-old range, whether they were 40 or 105. And I have indeed moved 100-year-olds back to a 25-year-old range.
Wow.
And they do better. They can walk faster. They can climb the stairs again. They don't go to the nursing home. They live at home.
Right. Have you seen any downside at all to that? And because I've got to say, of all the physicians that I've spoken to, especially those who do hormone replacement therapy, I've never heard one target an age range. Now, obviously, I know that 25 is kind of like the peak, but I've never heard from a physician's protocol saying, okay, this is kind of our benchmark. Anybody that walks into the clinic under any age, that's going to be our North Star as far as hormone balance and replacement. Is there any downside to it?
I have 4 rules of medicine. First rule of medicine: anything strong enough to help is strong enough to hurt. There is a downside to every decision we make in medicine.
Okay.
Do I treat with this? Do I treat with that? Do I use this dose? Do I do that dose? Do I do long-term? Do I give breaks? Every decision we make has an upside and a downside. And the doctor's job is not to give you things that have no risks. They don't exist. Your doctor's job is to give you as many benefits as possible, balanced against as few downsides as practical. Yes, there will always be potential downsides. People are worried about the roid rages, the bodybuilders that they don't peak their testosterone at 7 or 800 nanograms per deciliter, which is kind of my starting point. 7 to 800 nanograms. That's about where a 25-year-old usually is, not an 18-year-old, a 25-year-old. He's already moderating. Um, but if when you were a young man and you were at your healthy testosterone level, if you were an antisocial bar fighter, I'm not putting you back there. Okay. If you were a well socialized human being who respected the people around you, I'm perfectly happy to move your hormones back there because you did well with them before, you'll do well with them again. But if you couldn't stay out of jail because every Saturday night you were smashing somebody's teeth, no.
And how do you figure that out, Doc? Do you do like like kind of like a background, just like a questionnaire, like an interview session?
We we see our patients for over 2 hours before we actually accept them as a patient.
Okay, I like that.
We do what we call our health analysis appointment, where you come in, you fill out a medical history, and it's a big, broad medical history. And we do a couple of basic tests on you just to see where your highest risk factors are. And then we draw blood. We get you a panel that gives you about a 70 to 75 page printout.
Mhm,
We've testing things that your family doctor has never tested in their life.
mhm.
And we use that our basis. And then we're going to sit down with you a second hour face to face with the doctor. And we're going to go through all your labs. We're going to reprise your history again. And we're going to kind of come up with a plan, of all the issues you found. And here are the issues we found on your testing and evaluation. Which three are we starting with? We tackle the things that are highest on our list first.
Okay.
And then we bring you back in a couple of weeks. We see how you're doing. We make any adjustments based on your clinical response. We bring you back in 6 weeks. We measure all that lab again. Because once we started shifting hormones, things are going to start changing. Your metabolism will change. How you handle the hormones will change. So we need to recheck your levels. And then we'll make an adjustment. And then we'll bring you back in about 3 months and we'll check everything and we make another adjustment. And anytime you need to see us in between, you come in. When you join our program, you get unlimited visits for what we do. Now, we are not your pulmonologist. We're not your cardiologist. You sprain your ankle, that's not us.
Right.
But we see people as often as we need to see them for what we do. And then going forward, we will see you at least every 3 months to evaluate where your diet, your exercise, your weight management, your muscle mass. We will measure your muscle and your fat in all 4 extremities and in your torso every 3 months. We'll see how you're doing physically. We love it if it's a couple, so we can talk to your spouse. Yeah. Are you two in sync in the bedroom now? Or are one of you or the other unhappy for some reason? And how can we do to normalize this? So, yeah, we keep really close tabs on our people. We see them a minimum of every 3 months, and it's a full hour visit so that the doctor really gets to know their people and know them well, and you can work together. This is not a project we can do to you or for you. We have to do it with you.
Sure.
You have to be an active participant in this clinic.
Now, one of the things that I would like to know is like going back to the talking about fat. Did you happen to see that it's getting a lot of attention? Jillian Michaels was on that Jubilee debate show. That it's a YouTube deal where they'll have like a whole room full of people come in and they'll debate one individual. And this one was Jillian Michaels, I guess she got famous for The Biggest Loser or whatever. And she was trying to explain to these people that were all part of they call it the positive body movement, which is basically like, don't make me feel bad because I'm fat movement. That, it was one of these deals. And some of the thing, and they just didn't want to hear the damage that being, overnourished, whatever fat would do to you. going back to this whole hormonal cascade that we can have, talk about how fat or overnutrition can lead to inflammation. So therefore, your body's trying to fight to repair itself internally at the cellular level. So therefore, it can't function in just the normal cadence of life. And what that means, because one of the things I keep hearing over and over, the more you study longevity and health span, and like fasting became, the rage. I've done intermittent fasting and everything, but really it's just calorie restriction at the end of the day. And there seems to be such a profound impact on our human body when we restrict our calories. You know, talk a little bit about caloric intake, nutrition, lowering inflammation, and what that does to keep these hormones in balance, for the average person out there that's listening right now that and they heard you say that they can't see their abs and they're freaking out. They're going, "My God, I haven't seen my abs since I was a teenager." How all this kind of works together.
Yeah. Well, you got to remember when I say if you can't see your abdominal muscles, your excess muscles, you weigh too much. And
Right.
that's true. I
Yeah.
mean, it's the simple fact of life. Those muscles are there to be seen and used.
Right.
But there's degrees. That's why we have this thing of being overweight versus obese. And that is a totally arbitrary line that a bunch of doctors in the 1930s or so came along and said, well, these people are fat, but these people are really fat. What do we, at what point
Mhm.
do we, and we drew an arbitrary line. Your body doesn't know diddly squat about that line. What your body knows is that it is progressively more inflamed and you got more and more pain. When I was in medical school 50 some years ago, we thought chronic back pain in older people was a simple mechanical stress issue. You're carrying around more weight. Of course, your vertebrae are going to start pounding down and you'll collapse your discs and the vertebra will start to degenerate. No, it's the inflammation in the bones that is causing the problem. Your knees didn't wear out because you walked and ran. Your knees actually wear out faster if you're sedentary, because now you develop chronic inflammatory. The minor trauma, the minimal trauma of use actually triggers healing and growth. So you have to have micro trauma, day-to-day use. Now, there's a difference in going whole hog on the weekend and beating yourself into the ground and using day-to-day micro trauma.
Of course.
The weekend warrior is probably doing more damage than good. The guy who does some activity every day is doing better. But you got to remember, muscle is a very high energy intensive tissue. It burns calories just by existing. It can't exist if it's not well fed. You get lots and lots of calorie burn for every pound of muscle you produce. So exercise, making muscle, is an important part of losing fat, because now all of a sudden fat doesn't burn many calories. Fat is storage. Fat is put there in an effort to lower your blood sugar, quite frankly. Okay, it's a secondary method of lowering blood sugar. If your pancreas can't produce enough insulin to drive that sugar out of your bloodstream into the tissues to be burned, and if the tissues are resistant, they're saying, wait a minute, I can only burn so much sugar at a time. I'm not capable of burning this much. So it resists the insulin to say, don't drive me any more sugar into here. And then your blood sugar starts to rise, but that sugar, that glucose, is fuel. It's an oxidizing agent, and it's damaging your arteries. It's actually burning the arteries and the veins that are carrying the blood. And so your body says, crank up some insulin, drive that sugar into the cells. And the cells say, wait, I can't burn that much. And so what happens then? Well, your body takes a secondary mechanism and it says, I've got to get this sugar out of the bloodstream. Some I'll dump through the kidneys. And so we'll start wasting sugar in our urine. But now the liver gets involved and it says, I'm going to turn that glucose into triglycerides, short chain fats, little 3-molecule fats. And those will be pulled into the adipocytes, the fat cells, and stored. And so you start gaining weight. Your insulin resistance from overfeeding drives your sugar too high, and so triggers your liver to grab that sugar, turn it into short chain fats, and store that fat everywhere on your body. So this is actually a secondary method of trying to control your blood sugar. Most people don't think of fat that way, but that's what that fat is.
Right.
It's a storage mechanism to get your sugar out of your bloodstream, so it doesn't destroy your arteries and your brain and your kidneys. So, I don't look at fat as a cosmetic. I don't give a damn about your beach body.
Right.
What I care about is, are you killing your brain?
Yeah.
Because if the brain won't work, the rest don't matter.
Yep. Yep.
So are you killing your brain? Are you killing your kidneys? Are you killing your eyes? Are you thinning out your bones? And as those joints start to degenerate, you're going to start having more and more pain. You're going to get back pain, hip pain, knee pain, shoulder pain, and that's going to limit your activity. And when you limit your activity, well, now you can't exercise anymore. And now those muscles aren't flexing. And now you're not producing the myokines that are trying to protect you. And what do you do instead? Well, you use that energy to produce more fat.
Yeah.
And it's a cascade.
Yeah.
If I can reverse that hormone balance so that your body preferentially wants to make muscle instead of fat, and then if I can moderate your eating and increase your activity, now we're moving in the right direction. And now, of course, with the GLP-1s, we have a big help. For 18 months or so. Most people will continue to lose weight for the first 18 months, but then about 4 or 5% of them, it becomes ineffective. And even if they're still using it, they'll start to regain the weight.
Right.
So somewhere along the way, you've got to, again, add the muscle mass, change the metabolism, and get rid of the inflammation. These are all critical. You mentioned something in your early setup here. We talked about mitochondrial health.
Mm-hmm.
Do you mind if I segue to that for just a little bit?
100%. I love to, and I like you to do it because it's another one of those in our space where people is if they can say mitochondrial, then it gives them credibility, but most of them don't know what the hell it means.
Sure.
So 100% because it's something that I have realized it's when I'm exercising, training, and all my diet, so much is geared toward that powerhouse of the cell. So yes, absolutely, Doc. Talk as much as you want about mitochondrial health.
Mitochondria are organelles within every cell. And actually, one muscle fiber, all the way from my shoulder down to where my bicep inserts, that's one cell. That entire long fiber, that's one cell. But it has mitochondria scattered along the length of the cell to produce the energy for each of the little segments to contract separately. Okay. That mitochondria produces the energy for life for every cell in your body. The problem is mitochondria are fragile. Most people have heard of DNA, the double helix, a double-stranded helix that wraps around a histone core that Watson and Crick came up with in the 60s. Mitochondria don't use that DNA. Mitochondria have their own DNA. And it has nothing to do with your father. That other DNA, the nuclear DNA, you get half of that from your father, half from your mother. You're a hybrid of two people, okay? But mitochondria, we only get from our mother, from their mothers, to their mother, to their mother, to their mother, all back to humanity. We can track mitochondrial DNA back to the prototypical pre-Homo sapiens sapiens.
Wow.
And so that mitochondria that is totally separate from our nuclear mitochondria is not a helix and it's not double-stranded. It's a single strand of DNA and it's a circle. It has no beginning, no end. It's round and it is incapable of repair. If you get free radical damage, radiation damage, glycolysis, anything that can damage the nucleic acid in your mitochondria, when it's toasted, it's toasted. It's just dead. Okay. So mitochondria have come up with this really interesting mechanism that if one mitochondria loses its functional DNA, it simply fuses with a second mitochondria and now makes a bigger mitochondria. And if the muscle is demanding, if the cell is demanding more energy than the mitochondria can produce, the mitochondria undergo fission and they separate and make two mitochondria. And so some cells have a lot more mitochondria than others because cells that have a big demand on them fission their mitochondria, produce more and more mitochondria to produce more and more energy to get more and more work done. But if you have an inflammatory lifestyle and you are flooding yourself with inflammatory products and free radicals and too much sugar, glycolysis, you damage the mitochondria and the mitochondria become senile, senescent.
Mm.
Now, this is a whole new area of anti-aging medicine, of longevity medicine. So I'm going to be telling you some things that a lot of doctors don't even know now. The mitochondria become senile, they become senescent. And those senescent mitochondria change their shape. They become big and globular, and they no longer produce the ATP, ADP that you need for energy. They actually now start kicking out inflammatory products, pro-inflammatory products, reactive oxygen species that damage the nucleus of the cell. And so the damaged mitochondria, senile mitochondria, cause the whole cell to become senile. And now this senile cell, this senescent cell, the whole cell changes and no longer does what it's supposed to do. And the cell starts kicking out anti-growth, anti-healing, anti-repair chemicals into its cellular environment. And in the medical literature, they actually refer to these as cellular zombies.
Wow.
Okay? It's really kind of funny because it's just like the movie Zombies. These senile cells, these cellular zombies, recruit new zombies. They turn healthy cells into senile cells. And so senile cells make more senile cells, and they inhibit the growth, healing, and repair of healthy cells. Now, every cell in your body was designed to do its job for a certain particular period of time. But at some point, it reaches the end of its lifespan, and it gets damaged, and it either needs to become replaced. And so it undergoes what's called autophagy. Autophagy. Latin, it means self-eating. It eats itself. It destroys itself. It breaks itself apart, and the components get used to make a new cell. But a small percentage of cells at the end of their lifespan refuse to die, and they become senile. They become senescent. And those senescent cells are destructive. They trigger cancer. They trigger heart disease. They trigger the death of the cells around them. And so your immune system recognizes that these are bad. I can't have these. They're going to kill me. And so your immune system sends out these macrophages, and they destroy senile cells, clear them from your system. And when you're young, they do this really fast. Okay. And so those cells last less than a day, less than 20 hours. And so a teenager will make senescent cells, and the next day they're gone, and they're replaced with good cells. Here's the scary part. At some point, it turns out that the immune cells, because they replace themselves quickly, because they are turning over very fast, the immune system will kick out new immune cells in a matter of an hour or two. You'll flood yourself. You get a splinter in your finger, and all of a sudden, you're kicking out all these cells to come fight that foreign body. Okay. Mm-hmm. But that means, though, that they're reproducing very quickly. Telomeres shorten and shorten and shorten. They hit the Hayflick limit, and the immune system starts becoming senile.
Mm-hmm.
It forms senescent cells. And so as we age, our immune system, whose job is to clear the senescent cells, is becoming senescent itself. And it does a less and less good job of clearing. And somewhere between about 45 and 55, so average around age 50, most people are now making senescent cells faster than they can clear them. And the number of senescent cells starts to climb, almost logarithmic. And this is happening in your brain, your heart, your lungs, your bones, your joints, your kidneys, your eyes, everywhere. But the most important one is the immune system, because this is the system that's designed to find new mutations, new wannabe cancers, and kill them before they become a cancer that can kill you. This is the system that's designed to keep your arteries pristine clean so the blood flows to your brain and your eyes and your kidneys. And as the immune system becomes pro-inflammatory instead of anti-inflammatory and becomes inhibited in its ability to find bad cells, we start going downhill faster and faster and faster and faster. Let me get back to, I told you 30 years ago, we recognized people were losing their hormones, and our reaction was, let's replace the hormones.
Mm-hmm.
Now, why are you losing your hormones? Well, we now know that when you go to autopsies of people of different ages, and you start looking for senile cells in the testicles and the ovaries and the adrenals and the pituitary and the hypothalamus and every gland in your body, those glands are being invaded by senescent cells, and they're building up the senile cell load. And so that senescent load building up in your testicles is why your testosterone level was dropping. That senile cell load building up in a woman's ovaries is why her estrogen, progesterone, and testosterone are all three dropping. The senile cell load building up in your adrenals is why your corticotrophic hormones are being less and less effective, and you're producing less and less of pregnenolone, dehydroepiandrosterone, etc. Cortisol. So all of these things are going downhill because your body is building up senile cells, which is really kind of a fascinating. So now we're getting down to the underlying mechanisms of why 30 years ago we started seeing people's hormone levels dropping out. And in those days, all we could do is replace the hormones. Now we can go in and remove your senile cells.
Oh, wow. And how does that work? And by the way, a real quick question. Are you familiar with Joel Green's work at all, who wrote the immunity code?
Yes.
Okay, so
Yeah.
Joel's a friend of mine. He's been on the show a few times, and a lot of what you're saying, and like that's where I learned a lot of this as far as strengthening the immune system and how it starts from the gut and bifidobacterium and those sorts of things. So a lot of this is tracking, and I think it is something that few people truly understand the linkage between cellular health, immunity, and all the things you're talking about. So this is gold.
Yeah. People say, why do you? They're looking for the one thing. It isn't one thing.
Right.
It's a complex organism. It's a symphony that is being, and as the instruments started getting dinged and banged and out of tune, things start going to hell.
Yep.
The music gets less and less beautiful.
Yep.
And that's aging. What we need to do is to refurbish the enemy, refurbish those instruments,
Yeah.
get them all functioning better again.
Yeah.
Yeah, we've been treating senescent cells in our clinic for about 3 years.
Okay.
And it is just fabulous to see what is happening with our people.
Well, tell me about that. I mean, how does that work? I mean, removing the senescent cells, is it through nutrition? Is it something that is it an invasive? Like, what does that look like?
Well, first of all, it's not one thing,
Okay.
a lot of stuff. There are things we can do. There are medicines I can use that will reduce senescent cell load.
Okay.
But the medicines have their downsides. Dr. Mixon's 4 rules of medicine. I already told you rule number 1,
Mhm.
in it, the help is strong enough to hurt. When I start using, senolytic medications, there's going to be some downsides associated with them. Okay. My second rule, The proper dose of anything is just enough to do the job.
Mm,
Any more than that, you start seeing more and more adverse effects.
okay.
Third rule of medicine: if you don't measure, you don't know. And this is too important for guesswork. We're dealing with your life.
Right.
And my new age friends say I'm going to cycle her over and over and over and over again till I get it right. And my Christian friends say, no, no, you're going to go to heaven or hell. My Catholics of course give me an intermediate ground. I can go to purgatory for a while. Uh, I don't know. Huh. I talk to God a lot. He doesn't seem to answer, at least not with postcards that I can read. But but it's a complex process. One thing: working muscle kills senile cells. Fat increases senility.
Mhm.
The more fat you've got, the more senescent cells you're going to produce because you're making more inflammation and you're killing your mitochondria. The more muscle mass you've got and the more frequently that muscle is used, the more you will reduce senescent cells. Kind of a fun little study from, oh golly, gee, probably 6 or 7 years ago now. They took some overweight women. I don't know why women, well, I do know in part because women tend to be fatter than men. Okay. It's a difference in our hormone load. As women age and their senescent load builds up, they lose their estrogen alpha receptors and they become predominantly estrogen alpha or beta receptors, and that predisposes them to a male fat pattern. But anyway, they biopsied the fat over their thighs and stained it looking for senile cells, for senescent cells. And they measured the number of senescent cells in the fat overlying the thigh. And then they put the women on a exercise machine in which they put weight on their ankles and they had to move their feet up and down and exercise these big thigh muscles.
Mhm.
Over 3 months, they gave them really good thigh strength. And then they went back and rebiopsied the fat. And they had cut the number of senile cells in the fat in half.
Oh, wow.
The myokines produced by the muscle killed the senescent cells overlying the muscle.
Wow. Wow.
So myokines kill senescent cells. Lean, fit people who exercise build up a senescent cell load slower than sedentary, overweight people.
Mhm.
Pretty simple.
Yeah. Yeah.
So that's one of the things we want to do. The other, of course, is, we want to keep your blood sugar down and your insulin load down so you don't develop insulin resistance, because that glucose, that high blood sugar, is causing cellular damage throughout your body, in every organ in your body, and triggering some cell death and some cell senescence. The cells that don't die become senile. So lower your blood sugar, build your muscle, get laid. Okay. These are lifestyle sort of issues. Then yes, I can use dasatinib and quercetin. That's the one that has been used in most of the medical research. It's the best studied. We understand the side effects and benefits best from that particular drug combination. There are several other drugs that we can use, and there are some supplements that also can be used to some degree, although you have to use mega doses, much higher than you normally get in your diet. But yes, there are good studies being done in which they will use a dasatinib at 100 milligrams and quercetin at 1,000 to 1,200 milligrams a day for 3 days each week for some period of time. And then they measure the SASP, senescence-associated secretory phenotype. Senescent cells kick out, I told you, these chemicals: anti-growth, anti-healing, pro-inflammation, pro-cancer. That's the SASP.
Okay.
But every tissue puts out a slightly different SASP. So what are you going to measure? Your liver, when it's damaged, doesn't put out the same as your lungs, which doesn't put out the same as your heart, which doesn't put out the same as your bone, which doesn't put out the same as your skin. So there's this long list of chemicals of SASPs that we can measure to get your global kind of picture and infer from the amount of the SASPs that are in your system how much senescent cells you might be producing. But it doesn't tell us where and what load is. So the thing that has frustrated me for the last several years is I look at the research papers, and even the good people, like Mayo Clinic, Cleveland Clinic, these people are doing research, but they're crudely measuring the SASP, which is a byproduct. They're not actually measuring the senescent cell load. And they measure clinical response. They took people with idiopathic pulmonary fibrosis, which is where your lungs are replaced with scar tissue, and it's a 100% fatal condition. And they took these guys with advanced idiopathic pulmonary fibrosis, and they treated them with dasatinib and quercetin 3 days each week for 3 weeks. And at the end of 3 weeks, they were able to stand up and sit down faster and more frequently. They were able to walk faster. Clinically, they improved.
Right.
Didn't clear lungs, of course. This is all scar tissue that's, and a total of 9 days over 3 weeks was not going to clear out those lungs. But the question was, they cleared enough of their senescent cell load in only 9 days of therapy over a 3-week period to clinically give them physical improvement.
Wow.
So we started treating our patients off and on about 3 years ago. The problem is nobody knew what dose for how long and which cells are removing from which tissues at what load. So that just frustrated the hell out of me. Looking at the clock, we're getting a little late here, aren't we? I'm sorry.
We're good. We're good. I keep going. I'll take as long as you got, Doc.
I just hate to mess up your protocol.
No. This is great.
So anyway, I contracted with a translational medical laboratory here. And so we are using the research protocols and are actually now developing a test that we can do on our patients that will actually measure the senescent T cells in their immune system. We can draw their blood, isolate, use flow cytometry to isolate their T cells, and then measure those for senescence.
Okay.
And find out how big a senescent cell load my patients have before I treat them. And then we can start to treat them and measure them again and see what is their senescent load now? How much have we reduced it? We know from the research studies that have been done over the years, from a lot of them done in Japan and Europe and a few here in the United States, when you put it all together, we've actually got a nomogram. We know that when you're in your teens and early 20s, your senescent cell load in your immune system is in single digits. And then it starts to build slowly in your 30s and 40s, and in your late 40s to early 50s, it starts to climb really fast. And by the time you're 75 to 80% of your immune cells are now senile and no longer work.
Wow.
Now, put that together with what we saw with COVID. We had a new virus that came into the human population. And who died like flies?
Old people.
Old people. Because the old people no longer have an immune system that can fight.
Right.
To start with, most of our immune cells are made in childhood when our thymus is large. As we age, our thymus involutes and shrinks. We're using up our immune cells. By the time you're 75 or 80, you've only got about 15% of naive T cells left. 15% of your cells are now available to get tied to find a new antigen. But even 75 to 80% of that 15% is senile. So you got less than 2% of your immune system functioning by the time you're 80 years old.
Wow.
And so cancer, heart disease, infections, they knock off old folks like flies. So my goal for me and for my more aggressive patients, I want my systemic immune system, I want those numbers down in single digits. I don't want 70% or 50% or 30%. Okay. I want to remove as many of the immune cell or as many of the senile cells from my brain and body as I reasonably can. Because we know from the animal studies, and we don't have concordant proof from human studies as yet. Those studies are underway. They're in process right now. But I'm already pushing 80. I can't wait another 30 years for the FDA to come around. Oh, well, pay my money, take my chances right now.
Right. Right.
Uh, but we know from the animal studies, if I take laboratory mice live an average of about 25 months, a little over 2 years. But if we wipe out their senescent cells when they're 20 months old, equivalent to a man in his 60s, we extend their health span. They start acting younger. They start mating again. Their coats get glossy. They'll start running their treadmills faster. They solve their mazes quicker, and they live to 33 months.
Oh, wow.
They get a 36% increased health span and lifespan with a single treatment of senescent cells in the mice.
Wow.
So, guess where this 78-year-old man wants his senescent cell?
Yeah.
So yes, I carry the hormone balance, the global hormone balance, not just testosterone. I measure 8 different hormones every 3 months. I measure my glucose. I measure my inflammatory markers. I put everything back in a healthy 25-year-old range I can. And now I am in process, finally, starting next week, I'll be able to start running routine testing to measure my immune senescent load.
Wow.
How much more I need to treat myself than I'm doing right now. Now, right now, clinically, all my old man aches and pains are gone.
Hmm.
I stand up and I can stand up and run. I don't need to stretch and try to get my body to move in anymore.
Right.
I had to do that once upon a time. You know something about my background.
Mm-hmm.
I came into medicine because I was a shot up old combat man.
Hmm.
I took 1 round in the right forearm that lost most of my extensor tendons here. I took 2 rounds through the left arm, including the one in the elbow. I had a hand grenade shred my left knee. I took a bullet, clipped my right ankle, 1 in the right thigh. I had a gunfight with a Chinese 51 caliber that shot through the log, and bullets skimmed down over my back and blew off most of the right side of my ass. I've got shrapnel scattered all up on my side. I've even got 1 little piece of copper sitting in the diaphragm under my heart. I had a lot of reason for pain.
Right.
31 years ago, when I put my hormones back to a young man's level, my pain diminished. And that's because anabolic hormones decrease neurologic pain perception. Young men are famous for doing the most outrageous things to themselves, and they think they're tough because it doesn't hurt. Well, hell, it's easy to be tough when it doesn't hurt. When you get old and it all hurts, that's different, I promise you. But the hormone balancing decreased my pain significantly and allowed me to live a much better life. But 3 years ago, when I started damping down my senescent cell load, just by guess and by golly, using the same, basically I caged the Mayo Clinic protocol that they used their people, and I used it on me. And all my joint aches and pains went away. I now can bend and flex. I don't just can bend down and touch my toes at nearly 80. I can bend down and put the palms of my hands flat on the floor at my toes. I've gotten my flexibility back. I've got my strength back. I have good muscle mass. Actually was traveling to a fencing meet last weekend, and I had some woman, I wasn't wearing my coat, so my physique showed. And I had some woman actually stop me cold in the airport and ask how many days a week I spent in the gym. She said, "That body takes a lot of work." And I said, "No, ma'am, it really doesn't."
Yeah.
Oh. I almost never go to the gym. My wife is nagging me to drop my gym membership because my gym is right here at my desk. I mean, you see, I've got a nice office. I don't work in a cubby hole.
Right.
Okay.
Right.
Um, but I spend 5 or 6 hours a day reading medical literature,
Mhm.
and I can focus for 30 to 40 minutes and then I stop absorbing.
Right.
And so I turn around, I drop down behind that couch over there, and I'll knock out 50 or 60 push-ups.
Yep.
And I'm breathing fast, and I come back and I sit down or I can focus again.
Yeah.
And in 30, 40 minutes, I start to get glassy eyed. And so I step over there to the windowsill and I grab my 45-pound weights and I do curls and overhead presses until I'm breathing fast. And I put the weights down and I sit down and I study and read for another 30 or 40 minutes. And so about twice every hour in an 8-hour day, so about 15, 16 times a day, I get about 2 minutes of vigorous exercise.
Yeah. Yeah.
It doesn't take spandex. It doesn't take a gym. It doesn't take anything fancy. Now
Well,
it's true. You know, ate a good breakfast. I go out and I do 3 miles on the trail in the morning before work too.
right.
So there is that. But basically, you know, I'm a desk-bound doctor, and I stay lean and fit with short bursts of exercise a dozen plus times a day.
Yeah.
That's really true.
Yeah, and that's one of the things I try to tell people is that you don't have to do some soul crushing workout. It just needs to be, it's the compounding effect of those little doses, just like it's like a retirement account. If you just put a little bit consistently over time, it will compound. This is what I keep on my desk, Doc. It's a little timer, and with the
Mhm.
exception of if I'm doing something like this, I'm doing a podcast. I have one of the little small treadmills right in front of my desk that I'll walk on a lot when I'm doing meetings, or I set this timer and I usually try to sit for no longer than 30 minutes. And then I'll get up and I'll either walk on the treadmill for 5 minutes or do some jumping jacks, or I'll go down to my gym is in my garage. I'll go do some pull-ups. It might be 5 pull-ups, but just again, they'll walk back upstairs to my office just to get that movement consistently.
Yes.
Or I'll tell people do 100 air squats a day, and I don't mean all at once. Just set a goal that when you get up, do some air squats, move about your day, and try to cumulatively get 100 a day. Game changer.
Absolutely. You know, I get up in the morning, I shave, I do 25, 30 squats, I
Mhm.
drop down, knock out 60 to 70 push-ups. I go out and have breakfast. I do about 3 miles on the trail. I come back and change, go to work, and then I hit my intermittent stuff during the day at work.
Yeah,
It's not a major commitment. It simply says, don't spend your life sitting on your ass getting fat. That's
exactly. Exactly. Now, tell me a little bit. Now, you kind of segued right into something I wanted to ask you is kind of what your day looks like, but also you mentioned reading, and I know you're reading dense material because research documents and medical documents for this East Texas boy. Sometimes you say you can go 30, 40 minutes, use about 15, 20 minutes. I'm kind of glassy eyed, but I try to comprehend it. What are some other behavioral and environmental things that you do to make sure you stay in this peak condition you are at 78 years old?
um, I don't know. Yeah, I have a simple life. I don't socialize much.
Say,
Relatively solitary creature. I leave the office at 3:30 or 4 o'clock every day because that's when my daughter gets home from school.
yeah.
Messed up my first marriage because I worked 70, 80 hours a week. And I finally to stagger home after a 15-hour work day, and I had nothing left to give my family.
Yeah.
And it wasn't fair to them. And so, yeah, that marriage went this way. I was single for 17 years in between marriages. I met Bandine. Um, she has become the lodestar of my life. I focus. She treats me as though I am the most valuable creature on God's green earth, and I do everything I can to give her the happiest life I can.
Yeah.
13, almost 14 years ago. Next month, my daughter turns 14, April 12th. Um, you know, she decided she wanted a baby. And so just because I was 64 at the time, I said, okay, just because I'd had my kids, you can't tell a woman you really love that she can't have this basic part of being a woman.
That's right.
So, and we had a baby, started it when I was 64. She was born when I was 65. Um, you know, I want to do this right. This is my last chance to be a daddy to do it right.
Yeah.
And so being Ben Dean's husband and Ivory's father are the two most important parts of my life. Then I have my businesses. I have the 3 clinics. I have a supplement company. I have this clinical laboratory. I write papers. I'm presenting at medical meetings a couple of times a year now. I wrote my book.
Lifelong. Yep. Absolutely. I need to get a copy.
Right. Yeah, I'll have my staff send you a copy.
Thank you.
I actually wrote it for lay folks. It's not for doctors. So it's pretty straightforward. But, basically, my life is work and family,
Yeah.
work and family. Uh, because when I started out as a young soldier and got myself shot up, literally got my ass shot off. In the process, I killed way too many men, and I did not want my legacy to be the fact that I was an efficient killer.
Mm.
So I decided to devote my life to medicine. It was the most productive, pro-humanity thing I could think of to do. It was the polar opposite of what I had been doing. And so for 50 years now, I've been a physician, and I've done everything I can to give back to this country, but also to my fellow man. My whole goal is to, I want people to think about aging differently. I want the medical profession I want to be a part. I know I can't revamp it myself, but I want to be a part of changing the attitude of medical care that has not changed for thousands of years. Hippocrates, way back when, was recognizing symptoms and trying to intervene to make the people better. He was classifying diseases and trying to cure disease. And thousands of years later, every medical school on the planet is still doing the same thing. We wait till they have a disease, and then we try to fix the disease, forgetting it's so much easier to prevent a problem than it is to fix it.
Yep.
And so I want every medical school, every hospital, I want our medical care system to focus on what's making us sick.
Mm-hmm.
How do we avoid illness? Physicians should be spending most of their time making their patients stronger, faster, leaner, smarter, sexier, and happier than simply trying to ameliorate their suffering.
Right.
Okay. And reason your pre-show chat with me interested me a lot. I know that Bobby Kennedy is being treated by somebody.
Mm-hmm.
He's a 71-year-old man, and you don't get that muscle mass, quote, naturally.
Right.
Somebody is treating him similar to the way I treat my people.
Yep.
Yeah, I want to get to know his doctor. Okay?
Yeah.
But I want to be more like us in this world. And you want to change behavior? You change rewards. You want to know why anything happens on planet Earth? You follow the money. The rewards will tell you where it is. Right now, we reward doctors for treating disease.
Mm-hmm.
If we reward them for preventing disease, they'll prevent disease. That's got to start at the top, at the federal government, because the federal government is paying most of the medical bills in this country.
That's right.
If they change the policy, let me give you an example. Let's say just that I had this heart-to-heart talk with Bobby, and he had a heart-to-heart talk with the rest of the team up there. And they said, you know what? Medicare is now going to change the way they pay. From now on, your Medicare premium is going to depend on muscle to fat ratio. You're going to go to your doctor every 6 months. They're going to put you on a little device, and we're going to measure how much muscle you got in each arm, leg, and torso, and how much fat you got. And the more fat and the less muscle, the higher your insurance premium is going to be. Now, We know you're already 100 pounds overweight, you're sedentary, and walking between the car and the dinner table is your major exercise. So we start you with nothing.
Right.
So say your premium is here. If you drop your body fat by X amount by next 6 months, your premium will go down. If you drop it by this month, the next 6 months, your premium will go down. We want to see muscle going up and fat going down. Here's our ideals. Here's where you could be when you get where you should be. But until then, here's what you're going to pay.
Yep.
If people are paying out of pocket, it'll change behavior.
100%.
That simple. Everybody knows they need to eat less and move more, but the number that actually do it is small.
Yeah.
You need an incentive, and that incentive is in the pocketbook. That's been shown throughout planet Earth for millennia. As long as there have been human beings, we respond to essentially financial incentives.
That's right.
We need the government to change its approach to medical care.
Well, Doc, I'm trying. Like I said, I'm working with AFPI. I have got a great call with Hannah Anderson, who's leading that charge now. She's come over from HHS. And so I would love to, I will recruit your expertise, your help, and your vision, because that's what we've got to talk about more. You're exactly right. Align incentives with behavior that leads to positive outcomes. When you go to DC and you talk about value-based care and outcomes-based care and this sort of thing, they all like it. They all think it sounds good. They just don't know how the hell to implement it or what it really means. And physicians like you who have decided to focus on health care versus sick care, that's what they need to do. So I'm going to rope you in. And I got to tell you, and what you said about your daughter and your wife, you and I could not be. This podcast has been one of the most amazing gifts that I've ever had. It was started as a passion project. It now allows me to, I think, divinely. I'm a big believer in divine appointments, but everything you just said with your focus, your legacy, the older I get, the more I realize the only thing that really matters in this world is what you said, what I've done for my fellow man, but also being Jimlin's husband and Rylan and Abby's dad. You know, I'm paying for my first wedding next month. And so that's where I am and then her sister, who's 15 months behind her, I think she'll probably be getting married 1 year after that. And as I look over the course of my life, Doc, I'm to the point now where those are my greatest accomplishments are my family. And I, like you, I'm fortunate and blessed to have a wife that is the same way towards me as yours is towards you. She thinks I can rope the moon. I can't, but she thinks I can, and I'm going to do I'm going to do everything in my power to keep that to keep that vision of me alive.
Every evening you do
Exactly, exactly, 100%. And I feel like I hope you'll come back. I feel like we just scratched the surface. And where's home for you? Where are you located?
Well, right now we're in Kirkland, Washington.
Okay,
So
yeah,
one in Washington State, one in Tacoma, one here in Kirkland, and one up in Linwood.
okay,
Although Washington State is trying to follow in the footsteps of California, New York. And so I am moving to Orlando, Florida this summer.
all right, okay, okay,
So, Washington doesn't want people who provide jobs.
nope,
I'll go away.
yeah, yeah,
It's real simple.
yep.
So,
That's what Howard
you know,
Schultz did. I mean, that's what he did. And
uh,
have you ever bumped into Ben Greenfield?
no,
Okay, so
I haven't.
Ben, who is, I mean, you should be on his podcast. I mean, much larger audience than mine. Ben and you guys would totally click on. I can tell on a personal level as well as professional level. But Ben, he's the same way. He was in Spokane and now he's moved back to Idaho. He's out. It's for the same reasons. It's a shame.
Yeah. Well, I was looking for the best school for my daughter.
Yep. Yep.
So he is going to the Windermere Preparatory School.
Yeah. High
And,
school.
so a great school in Orlando. And so we're selling out and moving. I'm keeping the clinics here because I have patients here,
Yeah.
but I've got a great administrative staff that will basically run, and I'll fly back and forth.
Yeah.
I'll be here about 3 days each month.
Yeah.
Basically I'm going to shift home base to Florida, the free state where they actually encourage new jobs, growth, prosperity, and good health.
What a novel idea for government. Wow. Right. Well, Doc, this has been a blast. Of course, I'll have I'll do the intro with all your background and everything. And please, I do hope you'll come back. I don't want this to be the last time we speak. And once you get settled in Florida, maybe I'll give me an excuse to come out to Disney World and see. I'd love that.
Well, where are you located?
I'm in East Texas, so I'm about 90 miles outside of Dallas.
I got friends down in Arlington, Texas.
Oh,
that
sure, sure. Yeah.
And actually, I've got my head of the internal marketing is down in Dallas area.
Okay.
I get to Dallas fairly often, so
Please.
I'll stop and say hello.
Oh, please do that. That's I have an office in Dallas, and so that's a real easy thing. I was just there yesterday, and also I don't know if you've ever bumped into a guy named Gus Vickery, but Gus Vickery is a physician out in Asheville, North Carolina, and he's one of my business partners. And that's somebody we there's just a lot of connections that I would love to make for us to just geek out on some of the things that you're working on. Dr. George Ibrahim, he's out in Nashville. He's been on the show talking about menopause, and that's one of the things I'd love to bring you back on. We could just isolate one topic like perimenopause and menopause and dive deep into that.
What andropause?
Oh,
You always read about with the women. What are us guys?
I'm down. Let's do it. I'm in. Let's do it.
Let's do two. We'll do one on menopause.
Yep.
And one andropause.
You got it. You got it.
Okay?
You got it. It's a deal. It's a deal. Doc, I cannot thank you enough. Dr. Jerry Mixon, thank you for coming on the show. Folks, I'm the Healthy CEO. I'm Jason. Thank you for listening. We're out.
The content provided in this podcast, The Healthy CEO, is for informational and educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The opinions expressed by our hosts and guests are their own and do not necessarily reflect the views of the Healthy CEO. Any information provided by our hosts or guests, including any physicians who may appear on the podcast, is solely for informational purposes and does not create any doctor-patient relationship. Listeners are advised to consult with their healthcare providers before making any changes to their health routines. The Healthy CEO and its affiliates assume no responsibility or liability for any consequence resulting directly or indirectly from any action or inaction you take based on the information provided in this podcast.